I have written anything, but I will try to cover single proportion, cohort, case control, individual randomized control trial, only individual. I will not go through, because what I have seen that you have, none of you have in this anything in this domain. So first single proportion. Okay. Read this first. And all the examples what I will give you, all are published. All are my publications. So that means all have evidence that these are correct. Read this. What is the prevalence of anemia, undernutrition, overweight, and obesity? Sexually tract infection, reproductive tract infection. Chronic disease such as diabetes, prediabetes, hypothyroidism, and hypertension, and depressive symptoms among women aged 18 to 30 years residing in to urban neighborhoods in South Delhi. So that means here we were talking about only single prevalence study now. But here what we answered, prevalence of 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 conditions. How we will calculate samples?
Each of them
अलग सर अब बैठ जाइए अलग अलग ओके देख अलग अलग क्या है हम देख इसका मैं आपको ट्रिक बताता हूँ सुनिए ये तो सिंगल प्रोपोर्शन है कैसे करने सबको पता है फॉर्मूला है 4p/z²। एक फॉर्मूला हम सबको पता है वी नो आई विल शो यू हाउ टू डू इट बट इसमें ट्रिक आई एम टेलिंग यू इफ यू सी द कंडीशंस even the prevalence of these conditions are very severe anemia 3% है mild to moderate anemia 51% है BMI 86% है एक hypothyroid 7% है STRI 40% है so different conditions have different proportion and one of the assumptions we take when we calculate sample size for single proportion is that margin precision either absolute or relative okay now if you see the relative precisions what we took it ranged from 10 to 30 and another important the prevalence which are lesser we have taken higher relative precision for those conditions compared to जिसका prevalence कम ज़्यादा है अगर severe anemia का prevalence 3 है we took relative precision 30% और सबसे ज्यादा कौन सा है ये 51% इसका हमने 10% एनी आइडिया व्हाई
कम सर्कल में ज्यादा मिल जाएगा
मतलब इस तरह का देखो सिंगल प्रोपोर्शन का सैंपल साइज तो एनीवन कैन कैलकुलेट बट जब आप 10-12 कॉम्बिनेशन का सैंपल साइज कैलकुलेट करना चाहते हो वहां पे इस तरह का सिचुएशन विल कम कि एक कंडीशन का प्रिवलेंस बहुत कम है एक कंडीशन का प्रिवलेंस बहुत ज्यादा है सपोज अगर हम 3% के लिए भी 10% रिलेटिव प्रिसिशन लेते हैं 10% रिलेटिव प्रिसिशन का मतलब क्या होता है 10 का 3 का 10 मींस 0.3 मींस जो हमारा यहाँ पे 2 to 4 है वो हो जाता 2.7 to 3.3 95% कॉन्फिडेंस इंटरवल हो जाता 2.7 to प्लस माइनस 3.3 तो आपका मार्जिन बहुत नैरो हो गया जितना मार्जिन आपका नैरो होगा उतना आपका सैंपल साइज ज्यादा होगा जितना मार्जिन नैरो होगा उतना सैंपल साइज ज्यादा होगा एंड वी टुक 10% फॉर दैट 10% इसका है मतलब 36 to 44 ये अगर हम 40% लेते तो 40% मींस 40% का 40% कितना होगा 16 so then it would have been 24 to 56 बहुत the margin was very wide but as because we have different prevalence of different conditions we wanted to make some consistency about our assumptions of relative precision so that all the relative precisions are within some ranges कोई भी बहुत ज्यादा बड़ा ना हो कोई भी बहुत ज्यादा कम ना हो अगर हम यहाँ पे इसको 10% लेते तो सैंपल साइज क्या होता अभी यहाँ पे कितना है 1380 remember this now what I will do you can all see this यहाँ कितना इजी है मैं आपको दिखा रहा हूँ you don't need to depend on anyone sample size बेस्ड ऑन प्रोपोर्शन, सिंगल प्रोपोर्शन है, नंबर ऑफ ग्रुप 1, एक ही ग्रुप है, टेस्ट अवेलेबल, कॉन्फिडेंस इंटरवल सिंगल प्रोपोर्शन, precision, whatever you can take. I am taking it here relative. Expected prevalence proportion क्या था? 3%, means 0.03. Okay. Relative precision हमने कितना डाला था यहाँ पे? 30% जो डाला था हमने. Desired confidence interval. ठीक है. आगे अगर हमें इसको 10 करना था 0.03. सेकेंड एग्जांपल व्हाट वी गिव कि अगर हम इसको 10 करते रिलेटिव प्रिसिशन, कितना है? 1 लाख नहीं सॉरी 12,421. ठीक है. तो माय पॉइंट है 2 पॉइंट. 1, हाउ इजी टू कैलकुलेट सैंपल साइज फॉर सिंगल प्रोपोर्शन? वेरी इजी. Number 2, when you have multiple outcomes for which you want to calculate the prevalence, what you have to do? You have to develop this kind of matrix. This kind of matrix you have to develop, and in that matrix, most important thing is that what relative precision you are taking, that should be dependent on what is the proportion you are taking. Clear? उसके बाद रवि सर ने तो बताया that then what should be your final sample size? The highest one. The highest one was 1656. वो 20% से ज़्यादा कभी मर्ज करना मत. Regarding that non-response, you are going to adjust that. So it is so simple to calculate single prevalence. So what are the assumptions we are taking? What is the expected prevalence that you will get from previous literature? Second, relative precision, 10%, 15%, 30%. Third, 95% CL common, and then you have to put these three and you can calculate sample size. Okay. Let's come to cohort study. This is also can be done in master very easily, but I will give you the data code so that you can play. This is a study published in 2 years back. GWG means gestational weight gain. So the question was, what is the effect of inadequate gestational weight gain on small for gestational age babies? To give you a little bit of background, during pregnancy, we can't use BMI as the nutritional status predictor. Marker you all know. So then, what should be used as the marker of nutritional status during pregnancy? And nowadays, people are working. People are working on this gestational weight gain issue, and it is a good nutritional status to monitor the pregnancy status during pregnancy, nutritional status during pregnancy. So we had a cohort where we wanted to see the effect of inadequate gestational weight gain on small for gestational age. It is a cohort study, you all agree? The design is cohort, you agree, because you are recruiting pregnant women, you are following them up throughout the pregnancy, you are taking their weight at different time point, then they have an outcome, baby, and the baby is small for gestational age. And you all know the definition of small for gestational age, you all know that. So this is the study, cohort study is fine. Now we have to calculate the sample size. Regarding the calculation of sample size of cohort study, only 2 assumptions are required. But these are common assumptions. Power and confidence interval. Either you will have 80% power or 90% power. Confidence interval 95%, 90%, 93%, just common. But to calculate sample size, these 2 things are important. What? Remember this. Proportion of outcome among non-exposure. Proportion of outcome among non-exposure. Here, what is the outcome? SG. And what is the non-exposure here? Those who have inadequate or exposure. So that means adequate gestational weight gain will be our non-exposure. So proportion of outcome among exposure. This is one assumption you have to take, and this information you will get from literature. Number 1. Number 2. Assume relative risks. Means assume relative risks. I think Ravi sir, Vijesh maybe have told about that. Take care. Safe travel. You have talked about the relative risks. Relative risk means association between inadequate gestational weight gain and small for gestational age. from the previous literature you can take, from your theoretical assumption you can take. So what we took here, that there is a 50% increased risk of small for gestational weight, small for gestational age babies if the mother had inadequate gestational weight. So we have to go 1.5. You can take it 1.2, you can take it 1.3, you can take it 2.1 based on your theoretical knowledge and previous literature. So that means from cohort study, only two assumptions are required. Proportion of outcome in non-exposure and the strength of association, that is 1.5. Now, if you know these two things, then this is the data code. Okay? Now, let's do it, and I will show you how easy it is. Oh, sorry, I can't copy paste from here. You can take this slide, so you will have the codes with you. So what I have put here, power, two proportions, then 0.35, you remember, proportion of outcome in non-exposure, that was 35%. I put this at 0.35, comma, relative risk, हमने क्या डाला था 1.5, power 90%. जो sample size का दो ग्रुप है 167 in each. Now the next thing is important, interesting, not important, interesting. Now as I was saying, 35% you can get from the literature, but whether it is 1.5, 1.2, 1.3, 1.7, 1.9, you don't know exactly. I just put one number 1.5, but it can be anything, and also power can be 80% or 90%. So let's move the power, let's make the power here 90%. But what I have done, if you see, I took a range. I took a range from 1.2, 0.1 का मतलब है 1.2 plus 1.3 plus 1.4 to 1.5. So I took a range from 1.2 to 1.5 with a calibration between 0.1. You can make it 0.05 also. And then I put a graph. Now let's see what is coming. Now see how you can explore yourself with the sample size. What is in the x-axis? Different relative risk. मैंने 1.2 से एक margin देके 1.5 तक किया था. You can take it 2 also. What is in the y-axis? Total sample size. So what is showing it to me here, that if you have 1.2 relative risk with 35% outcome in the non-exposure, then you will need 2000 sample size. If you have 1.3, you need approximately 1000 for the count. You need this 1.4, then it is approximately 500, and it is 1.5, 500 is the count. So then graphically you can present this, and also if you remove the graph from here, then you can get this information in tabular format. Okay? So again my point here is that don't need to depend on other person to calculate sample size. Just you have to clear about your assumptions, then you can play with it. Now you can tell me why you are saying 1.5, 1.3, I don't know. It can be 2.2 also. So that's from there your conceptual knowledge, your domain expertise, your literature review, that helps. But you can do everything. So even when we do calculate sample size, we don't calculate sample size with a single number. We always calculate sample size and we develop a matrix like this. Then we take decision discuss among ourselves, because जितना बड़ा आपका sample size होगा, feasibility भी तो issue है ना, budget भी issue है. So then we discuss this way. So this gives you a background how to you can play with this. Now let's come to a case control study. This is also published. What is the association of antenatal uterotonic administration with stillbirth? I think you all know. Anybody from gynecology? No. There is that. Also literature showed that association of stillbirth with Mr. Postol. Let's. So for case control study, if you remember what I told about the cohort study, here also two assumptions. Again, two assumptions. What first? Probability of your exposure in जो आपका आउटकम नहीं है, नो आउटकम if I say, because still but here is your outcome, so live but is your control if I say. So probability of exposure in control, probability of exposure in control, and then the anticipated odds ratio. Okay, and then even the command is also said that place here it was relative risk means R risk and odds ratio, O ratio, and the same way I have done. Clear? Now the last one. The last one is randomized control trial. ये तो और भी easy है. Let's do the randomized control trial sample size for both of you. So, Kaustubh, so what is your expectation that in the control group, what will be the proportion of the patients will have, what was their outcome?
Surgical site infection.
Surgical site infection. What was the
10%.
10% in the control group you expected? And how much you are expecting in the intervention group?
4 to 5%.
So you are expecting 50% reduction. So power, two proportions. In the control group you are expecting 10%.
10%.
0.1. In the intervention group we are expecting 5%. And I am calculating for 80% power. So it will be something. 435 in each group. Now we can add 20% attrition. My point, what I am trying to say at the end of my presentation is that I have given you some examples and I have told you the basic assumptions you have to make while you are calculating sample size. If you are clear about those assumptions, then calculation is just happiness. Now whatever software you use. But the assumption needs to be clear and you back up to your mind how you are calculating. Clear? Thank you. Any questions?
Sir, like that CI of 90%, 95%, 80%. So how do we decide what is to be?
If it is a single proportion,
Okay.
if it is a single proportion, then there is nothing of power, because power comes when you are comparing between two groups. If it is single proportion, it's only confidence interval, and most commonly used confidence interval is 95%. आप उसको 98.3 भी कर सकते हो, 90 कर सकते हो, क्या होगा? 98.3 सबको नैरो हो जाएगा, जितना नैरो होगा उतना सैंपल से ज्यादा होगा. If you can make it 90%, it will be wide, तो सैंपल साइज कम हो जाएगा. Conventionally 95%. Right? Clear?
But if we take 90, 95, it won't make difference कि while we submit the study.
90 से कम करेंगे then
नहीं 90,
95.
मतलब 90 पे सैंपल साइज कम रहेगा ना सर?
90 पे सैंपल साइज कम हो जाएगा. So 95. उसको ज्यादा कर सकते हैं, but सैंपल साइज will increase. But don't go lesser than 95. Then
But
you have to rationalize.
later-
I don't have the rationale. Why you are?
But later on somebody can object कि आपने कम लिया है 90
Yes.
नहीं.
कर सकते हैं.
Okay,
So always take this 95%.
90%.
There are some situations when we do 98.3, 97.5. I will give example.
Okay.
But for single proportion, 95. Clear?
Another term was R, the relative risk 1.5, 1.
You have another.
Yeah.
Let me answer that first.
Yeah, okay.
Now, when you have compared either case control study, cohort study, or randomized control trial, you are comparing between something. So then the issue of power comes. Okay? If now what I am telling is practical issue. If you are writing a proposal for funding in a foreign means, I'm giving you some example like Gates Foundation, like Wellcome Trust, like MRC, like NIH, like Norway. You have to make sample size calculation with 90%. You have to, because 90% से क्या होता है ना, आपको जो result आएगा ना, that will be more confident and sample size will be higher. Have to do that. कोई option नहीं. But for ICMR, when you are trying to do small grant trial, you can calculate sample size both with 80% and 90% power, then see how feasible it is. For example, से आपका 90% पावर से सैंपल साइज आ रहा है 1000 और 80% से आ रहा है 700. You have a budget constraint also. So depending on that, take a decision. But if you are writing any proposal or for funding for foreign agency, never ever compromise that. Always calculate sample size based on 90%. But here you can explore 80, 90 करके देखिए कितना आ रहा है. अगर आपका 90% से जो सैंपल साइज आ रहा है and that is matching with your budget, it's fine. ठीक है? What is the next question?
That RR you take as 1.5, 2.1. How do we decide that?
How do you decide? It totally dependent on your subject expertise and the, what is there in the literature. So that means, one example I gave you, relativity is 1.5. Association between inadequate gestational weight and small for gestational age. Why I took 1.5? I could have taken 2, I could have taken 2.5, I could have taken 3, 4, 5. So I saw some literature what is the existing. And I found a range between 1.5 to 1.75 from the studies done in low middle income country. India का study है नहीं सब, एकदम भी नहीं है. I think this was the first study from India. Or based on your this one, let's see the literature. And second option is that as a gynecologist or as a public health nutrition expert, do I think that this association could be 2 or this association could be 1.75, this association could be 3? So it's based on me. So two things. Eight information we are taking from the what is available in the literature and what is my knowledge on that. Still, I am not sure. That's why I get another command here to see इसको थोड़ा सा titrate करके देखते हैं क्या होता है. 1.2, 1.3, 1.4, 1.5, 1.6, and what sample size I am getting. Then based on the availability of the research, I will write. So that's why in some places it is important to provide the matrix, not a single sequences.
नहीं तो मेरा क्वेश्चन है कि अगर मैं इसको 2.5 कर देता हूँ तो क्या इससे स्टडी की क्वालिटी पे इफेक्ट होता है सर?
स्टडी की क्वालिटी में सैंपल साइज का नंबर पे इफेक्ट होता है.
बस.
देखते हैं ना क्या होता है 2.5 से. देखते हैं करके देखते हैं.
ओके.
कम हो जाएगा बहुत ही कम हो जाएगा.
नहीं ये मान के चलते हैं कि अवेलेबल लिटरेचर 2.5. ये मान के चलते हैं ना, मान के चलते हैं अवेलेबल लिटरेचर 2.5.
And
आपका जो 1.5 था, 1.5 के हिसाब से आपका सैंपल साइज आया था ये 167.
हाँ.
टोटल आएगा 344. ठीक है. इसको अगर हम 2.5 करते हैं,
बहुत कम.
कुछ नहीं करना है, सिर्फ 1 की जगह 2 करना है. Now you have raised a very good point. Now let's see. I am doing another thing. ये 35% हमने लिया था to see कि proportion of SGA in adequate gestational weight gain. अब suppose देख चलते हैं ये 20% है. ये just 20% और ये 2.5. So everything is dependent on another thing. ये जो two assumptions है, these two assumptions are dependent. So that's why I'm again saying, from where this 20% came, from where this 35% came, from where this 1.5 came, from where this 2.5 came. That is your expertise. And don't take it positively or negatively. I'm just giving some examples. When I was in a medical college, when I was doing my MD community medicine, many assistant professors and many PG students used to come to calculate sample size. But when they used to come, they didn't have any idea about these two assumptions. अगर सर आप मेरे पास sample size calculation के लिए आ रहे हो, I don't have the subject expertise. I can say whether this 35%, 5% or 90%. You have to tell me. I can tell you what two information I need. Then from the literature search or from your experience, you have to tell me this two number. Then I can calculate. What I am trying to say after the end of today's discussion, if you know these two numbers, you don't need to go anywhere. Through available software, whatever you have, I give you one example, you can calculate and you can play with that. कि ये number एक number सही है और you need the multiple numbers. So the assumptions is the most critical thing. बाकी statistical software, whatever you will put, you will get.
Okay, and another thing is like if there is no evidence like Kunal is conducting a study, there is no similar study, then can we assume something safe like 1.5 is?
Sir, then I'm using the Andrew Fisher's formula. Na? In Andrew Fisher, I'm just deciding based
I
on
mean,
confidence.
मेरा मतलब simple question है कि if I don't have any literature evidence.
Then it can be taken as maximum 0.5.
नहीं अच्छा ठीक है ठीक है डॉक्टर मौली
So for example, आपके पास existing risk factors हैं किसी चीज के लिए, let's say for preterm birth or stillbirth, and if you are saying anything that increases the risk of stillbirth by 50%, as a clinician is very important for me. If it is a modifiable risk factor, I would have given advice about that to my patient. So then everything which is 1.5 becomes clinically significant, clinically important, not significant, clinically important. आपके clinical practice में if anything increases the risk of stillbirth by even 30%, that is something that you advise your patient about that modifiable risk factor. अब हम बोलते हैं 2 कप कॉफी से ज़्यादा मत पीजिएगा and literature में उसका risk relative risk is 1.2 and we are providing that advice to a patient, a pregnant woman. But when it comes to try and maintain your weight gain this much, or these are the interventions that you can do to keep your weight gain in this range, उसके लिए then saying 1.5 doesn't make sense if you are providing advice to them for a risk factor which has a relative risk of 1.2. तो आपके standard जो है वो 1.2 है. Anything that increases by 20%, you are willing to advise the patient on that. Then it becomes 1.2. Clinical importance becomes a very good tool to decide what is the relative risk that you want to detect. It's not about what the actual relative risk is. What is the minimum risk that you want to detect? Any sample size that detects 1.2 will also detect 1.5, it will also detect 1.7 and so forth. But if it is less than 20%, maybe this is the kind of thing where you don't even think that it's important to trouble the patient and say ये कीजिएगा ये मत कीजिएगा, because if the absolute risk of stillbirth is 3% and something modifies that 3% by 20%, that means you are saying 3.6% 3.6% बच जाएगा. उसके लिए मैं पेशेंट के बिहेवियर मॉडिफाई करने के लिए इतना मेहनत नहीं करूंगा. Then that's not what we are interested in detecting. वो जो कट ऑफ है आपका वो क्लिनिकल प्रैक्टिस और how you are dealing with other risk factors, that becomes the judgment for where to place it. Randeep, sorry, I don't know if
Needs done.
that's what you are planning
No,
on
it's
saying,
fine.
or if you have another method of.
It's fine.
So sir, we look for these assumptions only for the primary objective
Yes.
or for all the secondary objectives also?
No, this is a very good question. I would suggest for now only concentrate on the primary objective. But
In any type of study.
any type of study, only the primary objective. But what we usually do for the secondary objectives or secondary outcomes, you can calculate sample size. Usually that comes lower compared to the primary outcome. There is another method. I will just state that. Don't need to do that right now. Another way to think about that. See, you calculate sample size for the primary outcome and say our sample size is 500. And say we have 5 secondary outcomes. In that case, sometimes what we do, we don't calculate sample size for each of the 5 primary secondary outcomes. We do power calculation. Means that with 500 sample size, how much power we will have, whether it is 80%, 82%, 83%, 85% for the 5 secondary outcomes. Usually do that, but you don't need to do that. You currently, for the because we are trying to make things simpler. If you want to go complex, we can complex at any level. For simplicity, calculate sample size only for the primary.
Only thing in that is, do not choose your primary outcome on the basis of that. मतलब सबसे छोटा सैंपल
हाँ, वो भी
साइज
हम करना, please, हाँ,
इसको अगर
good
मैं
point.
प्राइमरी
Good point.
तो फिर
Good
it will
point.
be a problem.
ठीक है, the codes I don't know how can give. I can share the presentations with Vijay. You can take it from that. The codes are written, so you can use this data if you want.